Okay, I think we're ready to get started. Again, welcome to this week's office hours for ESG and ESGCV. My name is LaQuantia Goodman, and I am today's moderator. If you are just joining us, please go to the chat and introduce yourself with your name and the region you represent. As a reminder, this office hours session is being recorded for public record. Office hours recordings are on California ESGCV past trainings webpage. A copy of the slide deck and recording will also be emailed to you. Next slide. How to ask a question. All questions must be submitted in the chat box. Please type your organization and question into the chat box. The team will read questions out loud at the end of the presentation and will provide answers, if possible, throughout the presentation. All questions and answers entered into the chat box will be recorded as part of the public record. Alongside our presenters, we also have several HCD staff, including ESG representatives, ESGCV grant administrators, and other consultants who are able to answer questions during the question and answer session. Next slide. Today's office hours agenda includes the following: ESG and ESGCV updates, office hours updates, upcoming trainings, ESG and ESGCV question and answers, and today's spotlight session, ESG rapid rehousing requirements. Next slide. For our ESG updates, 2021 contracts. HMIS, have you entered your contract number into HMIS yet? If not, this must be completed or should have been completed no later than February 28th. Any questions that you may have, please reach out to Sarah Theobald at sarah.theobald@hcd.ca.gov. 2021 standard agreements. If you have been awarded homelessness prevention funding and you have not turned in your updated policies and procedures for HCD to review and approve, please make sure that you do so, because HCD will not reimburse any HP expenses until this process has been completed. If your contract has been executed and you need help navigating the eCivis system to complete your RFFs, or to add additional people from your agency to manage your award, please reach out to esgnofa@hcd.ca.gov and we will provide TA to you. Next slide. Avoid receiving standard 209s and reimbursement delays. All 2021 contracts are managed in eCivis. All requests for funds must be submitted through eCivis by clicking the Financial Report tab. Please do not email these requests to your representative. Every request for funds must also include a completed detailed expense report. HCD is conducting mini monitoring for every reimbursement request. This will include anywhere from 3 to 4 line items chosen by your HCD representative, and will also include complete client files if requesting reimbursement for rapid rehousing and/or homelessness prevention expenses. Reminder, all supporting documentation must be redacted and submitted through the secure SharePoint site. Please do not upload the documentation in eCivis, as noted in HCD's PII policy. Be sure to have your supporting documentation ready to submit when requested from your HCD representative. Next slide. 2022 applications. Award announcements are coming soon, so please stay tuned. Match exemption applications are currently being scored and will be announced with awards. As a reminder, you cannot add additional people from your organization to view the application or award until a contract has been executed. Next slide. ESG waivers for subleasing, rental assistance agreements, and fair market rent. If you have previously submitted a waiver for any of the items listed above, please let us know by contacting esgnofa@hcd.ca.gov or contact your annual representative. Next slide. Coming soon, new requirements in NOFAs. 2023 NOFAs are in development with an anticipated release in March of 2023. You must use the HCD approved resolution template without deviations. Please note, if the template is not used or a deviation or deviations are made, you will be disqualified for not meeting threshold. This will apply to all applicants across the board. Policies and procedures for all ESG components effective with 2022 contracts. Submit your organization's policy and procedures to the ESG team for review and approval process. Note, HCD will not reimburse expenses for the component until the policies and procedures have been approved. Please don't forget to review our policies and procedures on the ESG homepage under the Resources tab. Next slide. Listed are our ESG policy documents. These slides will be sent to you, so please review or access these as needed. Next slide. ESG team representatives, Diana, Giovanni, Tuesday, and Anthony. Please reach out to your ESG representative listed above or contact us at esgnofa@hcd.ca.gov. Next slide. And now for our ESG CV updates. Reminders for performance milestones. All program funds for projects, street outreach, emergency shelter, rapid rehousing, homelessness prevention, all must be expended by September 30th, 2023. All funds for HMIS and administrative costs shall be expended by October 31st, 2023. All final RFFs must be submitted to the department no later than November 15th, 2023. Next slide. Upcoming office hours topics. Next week, homelessness prevention requirements. March 22nd, rapid rehousing policy. March 29th, housing stability planning. And April 5th, de-escalation. Please see the training site to register for upcoming office hours or view past trainings. Next slide. Upcoming trainings for March and April. March 16th, shared housing workshop series, which will discuss different types of shared housing, how to operationalize shared housing, landlord engagement, and potential case management items to keep in mind to increase housing stability. On April 4th, there will be evaluating client eligibility. And this series is designed to be an introduction to client eligibility under the ESG and ESG CV program components of emergency shelter, street outreach, rapid rehousing, and homelessness prevention. Next slide. On April 7th, there will be low barrier emergency shelter, which will discuss exactly what it means for ESG and ESG CV shelters to be low barrier. On April the 11th, hiring people with a lived experience, the racial equity series. This session will review the concept of lived experience and lived expertise and share how organizations work to center and integrate PLE into decision-making, advocacy, and systems. Next slide. In upcoming May trainings. On May 2nd, documenting costs, which will cover all of the basics needed to successfully submit an RFF to California HCD for payment. And on May 10th, data-driven decision-making. This session will explore the use of data in everything from program design to racial equity. Next slide. And do remember that these slides will be sent out to everyone in attendance today. So you'll be able to click the link and register for these trainings once you do get the slides, or visit the website and get those slides. Do we have any questions or anything at this time? I think we had one in the chat, but we answered it. Next slide. If you have any further questions, please don't hesitate to contact us. You can contact your annual ESG representative or reach out to esgnofa@hcd.ca.gov or reach out to your ESGCV grant administrator. Next slide. And now I will turn it over to Michael Thomas and Kristen Delkamp so we can explore ESG rapid rehousing requirements.
Thank you, LaQuantia. Thank you so much. My name is Kristen Delkamp, and I am one of the grant administrators for California HCD, and I'm coming to you from Orange County, California. And let me introduce my partner here, Michael Thomas, who is going to kick us off.
Yeah, thanks, Kristen. So yeah, I'm Michael Thomas. I use EM pronouns. I'm a technical assistance provider with ICF, working with the ESG annual team, and I'm coming to you from just outside of Atlanta. You can see there on your screen. I'm sorry, next slide, please. Now you can see on your screen that we are going to be talking about requirements within the context of the Rapid Rehousing Policy. I believe there's another spotlight session that will be on the policy in a wider sense. We are talking about requirements today. Next slide, please. So I'm not going to dwell on this for too long because, again, there will be another session. But what you see here is what the manual looks like. Be aware that you can find that on the HCD website. The link is there, and that should be live when you receive copies of these slides. Next slide, please. So, guiding principles of the policy that sort of drive the requirements that you will see. That's what you see here. So one primary guiding principle of the Rapid Rehousing Manual is that rapid rehousing is an effective and efficient approach for moving people from homelessness to permanent and stable housing. And the requirements in the manual are intended to ensure that subrecipients create, I did not update that, they create rapid rehousing projects, not emergency shelter, that comply with all applicable federal laws, statutes, and regulations, provide assistance that's tailored to each participant's specific needs and housing barriers, and very importantly, implement human-centered best practices to providing rapid rehousing assistance that is low barrier and reflects the housing first approach. Next slide, please. So a very important note that we want to make here, the requirements we are talking about are not all inclusive here when we think about the world of things that apply to rapid rehousing projects funded by ESG. So specifically, the manual does not comprehensively cover all of the federal requirements. Subrecipients must read, comprehend, and incorporate all federal requirements. That includes the ones that you find in the ESG program interim rule. It includes 2 CFR 200, which is the Uniform Administrative Requirements, Cost Principles, and Audit Requirements. And if you have ESG CV funding, it also includes all of the applicable notices for that. So be aware that there's a lot of stuff out there outside of this manual, and you're responsible for comprehending all of that as someone utilizing these funds. Next slide, please. So the first requirement we're going to talk about is written policies and procedures. All rapid rehousing projects must develop and implement written policies and procedures. I'll refer to that as we go through this as P&P, that fully detail ESG rapid rehousing operations. What we're talking about here is project level policies and procedures. So if your organization is delivering rapid rehousing services, if you are providing assistance to people with this ESG funding, with rapid rehousing, then you are required to have these policies and procedures. The P&P must, at a minimum, include the items that we are going to describe on the following slides. Next slide, please. All right, your first requirement in the policies and procedures, coordinated entry integration. The P&P must detail how your participant intake process complies with the coordinated entry process for your local continuum of care, or if you're in multiple COCs, then you would need to comply with all of them. What this means for rapid rehousing essentially is how are you going to take referrals from the coordinated entry system into your rapid rehousing project? That must be in your policies and procedures. Participant eligibility. Your PMP must detail how the project establishes and documents participant eligibility. We'll talk a little more about that in some coming slides, but be aware that that needs to be in the PMP. The PMP must define the following things related to your suite of services. It must define the full suite of services that will be provided by your project. That suite of services can only include those that are eligible as outlined in the Rapid Rehousing Manual. And it's also notable here, it's not uncommon to see policies and procedures where whoever wrote them just dropped in the full list of eligible things. If your project is not set up, either because of its budget or because of its program design, if it's not set up to deliver every single one of those, then they shouldn't all be in your policies and procedures. Your PMP should outline the eligible activities that you actually intend to deliver under the Rapid Rehousing project. Should define the project's process for assessing each participant's barriers to housing and self-sufficiency, and the process to design individualized strengths-based service plans that ensure each participant receives only those services designed to address specific barriers. So in other words, tailoring your service delivery to the participant household. And finally, the project's process for periodically reassessing each participant's service plan and amending it to reflect both barriers that have been removed and new barriers that may have been identified. So in other words, it should show a process where you're doing an initial assessment of barriers, designing your service delivery to address those, and then reassessing that over time to make sure that you are still providing the appropriate assistance for that household. Next slide, please. The PMP must detail the project's staffing pattern, and that would include estimated caseloads for staff providing direct services, and it should seem reasonable. So it must be sufficient to meet any commitments or projections regarding the number of participants to be served by the project during a given period. So for example, if you only have one case manager, but you were projecting to serve 300 households, that's probably not reasonable. Your policies and procedures should show a reasonable caseload based on what you intend to do service-wise. And it must also detail that there is staff time for entering and maintaining data in HMIS or a comparable database if you're a victim service provider. And that must be done in an accurate and timely manner. So we want to see the PMP showing that there is staff time dedicated to that, because HMIS or comparable database for VSPs is a requirement. Under other requirements, this is where we sort of get into the fact that there are things outside of this manual that can affect your program. That includes things like the local written standards, for instance. So your policies and procedures must meet any other requirements for your project based on any other mandates, any other federal, state, local, or other mandates. And then finally, general operations. The PMP must provide sufficient information about the operations of your project that a person not familiar with the project could reasonably reconstruct it from the PMP. So it needs to have enough detail that someone could put it back together if they had to, using it as a guide. Next slide, please. And that's you, Kristen.
Thanks, Mike. All right, let's talk a little bit about policy and procedure approval. All ESG rapid rehousing PNPs must be approved by California HCD. So PNPs must be submitted to California HCD for approval. California HCD may choose not to issue reimbursements prior to PNP approval. California HCD is the sole arbiter of whether PNPs meet its requirements. PNPs are approved upon written, signed confirmation from California HCD, and California HCD reserves the right to withdraw its approval at any time. Next slide, please. And requirements around intake. Projects are required to develop a participant intake policy that ensures the project serves only those who are eligible for ESG rapid rehousing. Next slide, please. A little bit more on this on intake policy. in terms of participant eligibility, the intake policy must establish a process for determining whether a participant is eligible to receive assistance, including a methodology to assess literal homelessness. The intake policy must establish a process for assessing each participant's needs, including housing barriers for which ESG rapid rehousing is needed to resolve. And the intake process must comply with the local COC's coordinated entry process. Next slide, please. And sticking with coordinated entry for a moment here, projects are required to fully integrate the coordinated entry process for their local COC or COCs into operations. And projects are strongly encouraged to consult with their local COC or COCs early in the project design process to maximize coordinated entry integration. Next slide, please. A termination and appeals policy is also required. The termination and appeals policy must comply with all of the requirements of 24 CFR 576.402, terminating assistance. It must contain a provision that assistance will only be terminated in the most severe cases, and it must comply with any other mandates which may be found in California HCD contract documents, ESG written standards, or COC written standards. Next slide, please. To help develop compliant policies and procedures, California HCD has adopted a checklist. The checklist is a step-by-step look at what is required to be in the P&Ps, including specific client interactions such as assessing participants' barriers to housing and including reassessment. Ultimately, the policies and procedures must provide sufficient information about the operations of the project so that a person who is not familiar with the project could reasonably reconstruct it from the P&Ps. The most recent version of the checklist is maintained on California HCD's website at the link below, which will be included in the follow-up email to today's session. Next slide, please. And turning back over to you, Mike.
All right, thank you. So next, we're going to talk about eligible participants and activities, because this is also a requirement that you adhere to these with your project. Next slide, please. So first, we'll talk about eligible participants. You may only serve with ESG Rapid Rehousing Category 1 and Category 4 homelessness, which is Category 1, literal homeless. That's an individual or family who lacks a fixed regular nighttime residence, meaning that their primary nighttime residence is a public or private place not meant for human habitation. So we're thinking sleeping in a car, sleeping in a doorway, sleeping on a bench, sleeping on the sidewalk, that sort of thing. Is living in a publicly or privately operated shelter designed to provide temporary living arrangements. And that includes congregate shelters, it includes transitional housing, and it includes hotels or motels when they are paid for by charitable organizations or government programs. Or it can also be someone exiting an institution where they resided for 90 days or less, and they resided in an emergency shelter or a place not meant for human habitation immediately before entering that institution. And then we have Category 4, that is fleeing or attempting to flee domestic violence. This includes any individual or family who is fleeing or attempting to flee domestic violence, and they have no other residence, and they lack the support networks to obtain other permanent housing. Of note here, for rapid rehousing specifically, to be eligible for ESG rapid rehousing, those fleeing DV must also meet the requirements of literally homeless, as you see described to the left there in Category 1. Also of note, fleeing DV is understood to include survivors of human trafficking, and there are a few other things too, so just be aware that there are some other flexibilities there, basically. Next slide, please. So for participant eligibility documentation, if you attended our emergency shelter office hours, you know we went into detail on that. We are not going into that detail here for rapid rehousing today, because we will cover details on eligibility documentation for rapid rehousing in a later office hours session. So keep an eye out for that. We're not going to go into it in great detail here today. Next slide, please. So eligible activities that you must adhere to include financial assistance. And under financial assistance, you have rental application fees, security deposits, last month's rent. utility deposits, utility payments, moving costs, and emergency transfer lease breaking fees. And that is specifically if someone qualifies under the local emergency transfer plan because they are fleeing domestic violence. If they are being relocated for that reason, then certain costs associated with breaking the lease can be paid for as emergency transfer fees. Those would be eligible. Next slide, please. In the services category, housing search and placement, housing stability case management, mediation, legal services, and credit repair are all eligible. I will note that there are some restrictions around legal services and credit repair, so just be aware. You want to read the regulations and make sure that you know exactly what you're spending the money on when you have funding in those categories. Next slide, please. Finally, we have rental assistance. Rental assistance can be short, medium, or long-term. It may be tenant-based or project-based. And rental assistance must meet all HCD and HUD requirements. And that includes everything that you see listed here on the slide. There are a number of requirements. So any established caps on assistance, that would generally be something found in written standards. Restricted use with other subsidies. You cannot use double subsidies, so you can't duplicate. Fair market rent and rent reasonableness for the unit, rent calculations. So there are specific methods for calculating rent when you're looking at fair market rent and rent reasonableness. So you have to adhere to those. Late payments, lease requirements, and rental assistance agreements. So these are all things that you have to keep in mind when you are using rental assistance funding under ESG. Next slide, please. There are a number of additional eligible activities for ESG-CV that you cannot pay for with annual ESG funding. So these additional eligible activities you see listed here, it's training, hazard pay, landlord incentives, volunteer incentives, cell phones and internet, personal protective equipment, furniture and household furnishings, essential services, renter's insurance, vaccine incentives. Also of note, you can do sponsor-based rental assistance with ESG-CV. And provide assistance with subleases. Next slide, please. When we are thinking about ESG-CV and the additional eligible activities, please be aware that there are conditions and restrictions that apply to those. It is not just as simple as paying for the things that I just listed on the previous slide. There are conditions around those. So if you're going to be utilizing funds for those, just know that you have to be aware of those conditions, and those can be found in the HUD notices that you see listed here. So when I mentioned ESG-CV notices earlier in the presentation, this is what I was talking about. Next slide, please. And back to you, Kristen.
All right, thank you, Mike. So now we're going to get into some other requirements for rapid rehousing policy, and these just didn't quite fit as neatly in the previous boxes, so we're kind of calling these out one-on-one. So next slide, please. Let's start with duplication of benefits. For ESG rapid rehousing projects, a duplication of benefits exists when an application has received or would receive, an applicant has received or would receive by acting reasonably to obtain available assistance, financial assistance from multiple sources for the same expense, and the total assistance received exceeds the total need. Projects must establish and maintain adequate procedures to prevent any duplication of benefits with annual ESG or ESG-CV funds. ESG rapid rehousing projects are required to perform duplication of benefits analysis for each participant receiving financial and/or rental assistance. We have a couple of resources here that you'll receive when the slides are mailed out. The first one is the California HCD ESG-CV Duplication of Benefits Policies and Procedures Manual. One thing that I find very helpful in this manual is that it lists the steps to be conducted in the analysis of the duplicative benefits. And then we have a HUD document on ESG-CV, Duplication of Benefits Quick Guide, and that'll walk you through examples of duplication of benefits analysis that can be very helpful. Next slide, please. Program income. Program income is defined as provided in 2 CFR 200.1 and means gross income earned by the non-federal entity that is directly generated by a supported activity or earned as a result of the federal award during the period of performance. For example, a returned security deposit. Program income for annual ESG must be used in accordance with 24 CFR 576.2 and 576.401C1. Program income for ESG-CV must be used in accordance with HUD CPD Notice CPD 21-08, Section 3D, Program Income. And a best practice is to not generate program income. California HCD strongly recommends that subrecipients develop policies and procedures that, to the maximum extent possible, prevent the generation of program income. In the example of a security deposit, the monies would be returned directly to the participant from the landlord when the participant leaves the subsidized unit, for example. For more information, please see the California HCD ESG program income policy. And finally, prevent, prepare, and respond tieback. When ESG funds are used to prevent, prepare for, and respond to COVID-19, certain requirements related to documentation apply at the activity level, but not the participant level. For more information, see HUD's Homeless System Response ESG CV Prevent, Prepare, and Respond Tieback Flexibilities Guide, quick guide. Next slide, please. So this is the presentation that we have for you today. Do we have any questions that have come up? I see one from Ruth Humphrey. Are there documents provided for the calculation for the fair market rent? And Mike, I think we have that online, don't we?
I am actually putting the link in right now to the
perfect.
part of the HCD website where you can find the fair market rent and rent reasonableness policy. That is going to be the best place for you to go.
Great, thank you.
Yep.
And Kristen, we had one before then from Miriam. And she asked, what are the timing cutoffs between short-term, medium-term, and long-term rental assistance?
So if I'm remembering my regs correctly here, I believe short-term is up to 3 months, medium-term is up to 24 months, and then long-term is not eligible under ESG rapid rehousing. That would be longer than 24 months. That's where you're talking about permanent supportive housing territory. So yeah, those are the cutoffs. You know, depending on how the budgets are set up and things, I don't know that it makes that much of a difference. Really, what you're looking for with rapid rehousing is generally up to 24 months, subject to any restrictions on that time length that might be in either HCD policy or local written standards.
Mike, we have a couple more questions. One of them from Ruth Humphrey again is, are the COVID-19 waivers still in place for ESG-CV?
ESG-CV is driven by those CPD notices, so everything in those notices applies to ESG-CV until the funding is done.
And then we have kind of a long question from Ann Finn. Ann, wondering if you might want to come off of mute to give us your question.
Hi, this is Ann. Can you hear me?
Yes.
Yeah, we're just we just had a review of one of our programs, and we're trying to be efficient about the use of funds. So in our original application, so use of funds in terms of when a client is proven eligible through our CES into the ESG program, but then the rental assistance budget may not be able to support the assistance they need, and we're low on funding on that. Are we able to transfer them internally to, say, a COC funded program that does still have funds available for rental assistance? But would that be considered, if we use those funds from the COC, would that be considered a duplication of benefit? Or if it's mentioned originally in the application, I think we were going to be leveraging the funds in the initial. So I just am curious as we're writing this out.
My suggestion would be, if you receive a referral that you enroll them into whichever project, either ESG or COC, you intend to serve them with initially. Like, I wouldn't suggest trying to do transfers between projects because it gets very, very complicated, and the eligibility isn't exactly the same between ESG and COC. There are some subtle differences. It's very easy to get in a sticky situation and get in trouble when you try to do that. So I would suggest looking at your budgets and just enrolling them in one or the other from the beginning of their service with you.
Okay, thank you. I appreciate it.
Yeah.
Thanks, Ann. We've got another really good meaty question that came in from Megan Van Zant. Megan, do you mind coming off mute and sharing your question with us?
Sure, I'd be happy to. So just for context, our community has a Project Home Key site. We're in California. So maybe that doesn't make any sense. Anyway, we have a pretty high profile, exciting housing project in California. We have been able to rapidly rehouse people in this site, but we are doing it so efficiently that the process of getting into the coordinated entry system, getting enrolled in rapid rehousing before we rehouse them, the timelines are not measuring up. So my question is, it feels not right to me that if somebody meets the criteria for literal homeless, they're clearly eligible for rapid rehousing services, but our ability to rehouse them is so quick that we didn't have chance to go through the coordinated entry process. Is there a way to address that situation? Example, our street outreach team identified a woman with a child living in an RV on the side of the road. We were able to, because we had that availability, get her immediately rehoused, but she was disconnected from the coordinated entry system at the time of rehousing.
My suggestion here is going to be coordinating with the COC and figuring out a way to try and make that work with coordinated entry system. And that's going to be my suggestion for a couple of reasons. As someone who provides HUD TA on other projects, I can't suggest going around coordinated entry because that is a federal requirement. Rapid rehousing should be taking those referrals that way. I do want to acknowledge, though, that I know the reality of that looks different in different communities, and it's dependent upon how coordinated entry is set up, and it's dependent upon street outreach availability and things like that. So I think the best practice is going to be work really closely with the COC and try to find a way to make that work.
Okay.
I'm sorry, I know that's probably not the answer you were looking for, but I feel like that's the answer.
No, I feel like I've hit on this before, and I'm like, it's a little bit frustrating, and I understand you have to say and explain things the way you are saying and explaining them, but I guess from a monitoring, I don't even know how to answer this question. I'm not sure what to do, because I feel like we have projects that are absolutely in the spirit of rapid rehousing. They're absolutely what HUD wants us to do with these funding, but I'm like sometimes a little out of order in the way they want to do things, but I can't imagine they want people to prolong their homelessness while we put them in the coordinated entry system.
Yeah, I understand that that's frustrating, and that there are ways that it can be made to work, but it is something that has to be worked out locally because it just looks very different how it can be made to work from one place to another. I am just jumping in to give this office hours presentation, though. I'm not working closely with many of the communities there. So if any of our grant administrators or if anyone else on the project has anything to add, I would love to offer the opportunity for you to throw that out there.
I'll just say, hey, Megan, it's Chris.
Hi, Chris. You're not surprised to hear this question.
I'm not. I'm actually writing you an answer. That
okay. Thank you.
Cannot say.
Thank you. Sometimes absence of local context for me doesn't allow me to give the best answers. I appreciate that, Chris.
Okay, so we've got a question from Richmond Amoa. Do rent reasonableness need to be documented for every FMR eligible unit under annual ESG? And I believe that's a yes.
Yes, you must show that every unit meets rent reasonableness. There are different ways that you can do that. Without going into extreme detail here, I would advise you to check out the fair market rent and rent reasonableness policy on the website that I linked earlier, because it kind of talks about that. But at the end of the day, you do have to be able to document that every unit meets rent reasonableness.
All right. I think we're caught up on the questions that we have, but we have certainly time and space for additional questions if people want to ask. And I thought I had seen someone with their hand up earlier. So if you would like, we would love to hear from you.
Well, I don't see any more hands raised, or if someone did have their hand raised, they didn't raise it again, so we don't know who it is. Either you can raise your hand again, or there's Veronica.
Yeah, there's Veronica.
Well, it wasn't me that raised my hand earlier, but I just wanted to ask, Michael, could you put that link again in there? I'm looking through the chat and I'm having trouble finding it, to the rent reasonableness.
Yep, I'm going to put a link to the resources section of the HCD website, which has that and many other things that you might find helpful.
Got it. Thank you.
Yep.
Anyone else contemplating raising their hand or coming
We-
off mute to ask?
We do have from Kat. She says, thanks for the presentation, Chris. If there's a good response for very quickly entering people into coordinated entry to address the issue that was discussed, it sounds like many people on the call would be interested in learning.
All right, I'm just going to take a shot at it. That is slightly different from Mike because I do know this community a little bit. So I think one solution that I was working through, understanding how HomeKey works, and that at least this HomeKey project, I believe, is a blended project that has not only shelter, rapid rehousing, and PSH. Is there's no reason we can't immediately enroll someone in the project HomeKey as shelter while we're simultaneously talking to coordinated entry and getting them in rapid rehousing and never actually moving their unit whatsoever. That's what I was going to email you, Megan. It's half written, but I just said it out loud. That's something that I was
Chris,
thinking.
spell that out for me. Maybe I'm not following. So let's use my woman in the RV specifically. So street outreach finds her.
We get her in HomeKey tonight as an emergency shelter placement. As we work on looking at our housing stability case plan, we understand that she then needs rapid rehousing.
So maybe our error is we put her in HomeKey and coded the project as rapid rehousing, but you're saying actually it's shelter at that time.
Yeah, because I believe.
And didn't Michael just say switching projects is a bad idea?
That is not.
Is that something different?
Yeah,
Something-
I was talking about switching from ESG rapid rehousing to COC rapid rehousing. That's
Oh, I
dangerous.
see. Okay.
Going from shelter to rapid rehousing is perfectly fine.
Okay, so maybe this is really helpful because we do this all the time. So maybe we move them into Project HomeKey because it is a flexible project that provides both shelter and interim housing and permanent housing, honestly, which is the way it was designed.
Yep.
So Mary, that's not her name. We move her into HomeKey. She's in shelter in HomeKey while we go through the process, blah, 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 blah. And then she transitions to rapid rehousing.
Yes, and as far as Mary knows, she doesn't need to do any of that. Mary just knows that she has this unit.
Mary doesn't, right. Mary, we're just getting housed, which is what the federal government wants us to do.
Yep. And then you work through your process to make sure that they're appropriate for rapid rehousing and change it that.
Right.
What
What I'm
HomeKey
trying to
is so
avoid,
much
as Chris
fun.
well knows, is that getting in trouble for doing what the funding source wants me to do because I didn't follow something. And I'm okay with the bureaucracy. I just need to have the directions on how to do it. But
That's the beauty of HomeKey and the way
that makes some sense, Chris.
talked about your
That's
project.
helpful.
Immediately serve them, do the coordinated entry, do the housing stability case plan, make sure they need the rapid housing, they're eligible, all that good stuff, and then just don't even move them, just change what they are.
And to me, just feedback, I don't know, to the world. What's helpful about that is some of these households, I'm trying to be more mindful of the duplication of benefits, but for me to figure out, is this family actually eligible for CalWorks and she doesn't actually need rapid housing? That'll take some time to kind of go through the process of figuring out what support is, going through, is this one going to work? No, it's not for this reason. Is this one going to work? And then we get down to rapid rehousing. And you can't do that in one day, even when you're trying to like get somebody housed quickly.
That's the beauty of your flexible home key project and the way you design
Or the
it.
complexity and the problem with it too. So
Well, it's a direct result of the complexity of the way coordinated entry and our eligibility for HUD programs works. It's just not instant. And that's unfortunately, sometimes we need instant help. So that's why I exactly loved what you built and how you're going to operate it there in Mendocino.
okay, thank you.
Yep.
I see a question there directed to me that I did not say this directly when I was answering before because I was trying to find where it says it in writing, and I'm still trying to find that. I actually believe that ESG to COC transfers are not allowable. I'm just trying to find where it says that in writing.
And while Mike tries to find that, Shirley had her hand raised. Shirley, you want to come off mute and ask your question?
Yes, thank you. My name is Shirley. I am with ISC 2-in-1 Plus. I was listening to the conversation earlier about just trying to put everything into or connecting everything through the coordinated system. And I just wanted to kind of jump in. I know that we've had that issue in the past where we found somebody on the street, wanted to get them into housing, and we happened to come into a unit right off the bat. What we did is, because we knew that it was going to take us a minute to get a referral, we covered ourselves by inputting everything into HMIS, but also doing a reciprocal referral request. So now we know that we're working, like Chris was saying, in the housing plan, but where there's also a request for that reciprocal referral within the coordinated entry. So at least we're working both sides of the coin and at least trying to comply with all the policies and procedures and protocols that we need to comply with. So that I'm not sure if they're doing that in her program, but sometimes just sending in a request for reciprocal referral might be a good way to at least wait for that documentation back from the coordinated entry.
Hi, this is Veronica. I work with Megan. And unfortunately, our coordinated entry does not have that referral process.
Okay.
Yeah, we're kind of behind on that, but it's a concept we've thrown around locally, and that's really good, a really good reason to implement it. So thank you for that.
Thank you.
We have another question from Richmond. When can a hotel/motel voucher program be rapid rehousing?
A hotel motel vouchers would not be funded under the rapid rehousing component. So there really shouldn't be a situation where hotel motel vouchers would be set up as rapid rehousing.
And then it looks like we've got another question from Antoinette. I understand shared housing is a future topic. My question is, can renting a room in a house with a written agreement be an eligible use of rapid rehousing funds?
I'm going to look for support from someone who may have more experience. I believe the answer is yes, if there is a lease with each person in the unit. So it has to be a lease. It can't just be a written agreement.
The answer is yes, with the asterisks that Mike's talking about, and we are going to have a full session on that. We did a session on shared housing last year. You find on our past website, past training website as well, that we'll talk a little bit through that, but we're going to get more specific in, I think it's April 7th, if I have it right off the top of my head, that we're going to dive deeper into, actually it might be this month. Anyone know the date? No, I sound like a fool. I don't know when trainings are. Shared housing is next week, the 16th of March. So we'll definitely dig in deeper on how to do it well, because I think what we've seen with shared housing is having folks live together is a natural thing that we need to do in any tight housing market in California. I consider the entire thing a tight housing market, but putting folks together that are a natural fit has been a problem, I think, in our shared housing models, and putting folks together that actually want to live together and that can live in harmony and not scare the landlord is really the point. So we're going to go through all of that in the shared housing presentation next Thursday. So the answer is yes, and with a lot of different kind of nuance to how to operate it well. Operating it compliantly is one thing, but really operating it well.
I see a question there about the hotel motel vouchers again. So yeah, if the hotel motel stay is being funded as a sheltering option while someone is being placed in rapid rehousing, then yes, that hotel motel voucher is essentially a shelter. That's how it would be treated under ESG at least. And it goes back to what we described earlier for category 1 literal homelessness. If someone is staying in a hotel and that's being paid for by a charitable organization or a government program, they are literally homeless, as if they were in a congregate shelter.
So Mike, someone wanted to reinforce something that it's Martha's question, but really about switching from ESG rapid rehousing to COC rapid rehousing, and how that is not always smooth because the two programs are slightly different. You want to just hit that point one more time?
Yeah, I'm having trouble finding the document I was looking for, and I think there might have been some revisions that had to be made to it or something. So maybe it's not available at the moment, but I would advise strongly against transferring from ESG rapid rehousing to COC rapid rehousing, because I really wish I could find this document that said that. However, the reality is, even if it is an allowable thing, it is very difficult to do well because the populations you can serve with the two programs are slightly different, and it's subject to change with COC funding every year because the annual HUD NOFO is where you find the eligibility for that year's rapid rehousing funding, and that comes out annually. So again, it's subject to change, whereas the ESG eligibility requirements are statutory. So until the ESG final rule is published, they are what they are. And so because of that mismatch, it just, again, could be very, very difficult, and it would be very easy to slip up without realizing it. So that's why I would advise against that. If, again, I think the best practice there is if you're accepting a referral into rapid rehousing, enroll them into one project, either ESG or COC, depending on which one they're eligible for and your budgets, and just stick with that.
Mike, was the resource you're looking for the classic 2013 rapid rehousing ESG versus COC? There's something fresh.
No, I thought there was a more recent document about transfers, but the only one that I'm finding is the ESG CV transfer considerations document. For what it's worth, that is a document about programs you can transfer people into from ESG CV, and it does not include COC rapid rehousing. It does include COC funded permanent supportive housing. So again, what I'm finding is more an absence of COC rapid rehousing in this conversation, which is what leads me to believe it's not a good idea.
Yeah, and I would just want to answer the question from QTAN, since I happen to be off mute and already talking. At what point is emergency shelter considered rapid rehousing? Well, those are two completely different things. So emergency shelter, it could be a hotel motel, but you are there on a basis that doesn't require a lease. For rapid rehousing, you are then permanently housed with a lease and support. So trying to blend the two into a project like what Megan was talking about is nice, but it's also complicated, as you can hear, to keep things separated and understand where folks really are. And obviously the flexibility that the state of California gives us is amazing through HHAP and our home key projects. but it does blur the lines in data collection queue to where things might be weird, where a person is in emergency shelter in a unit. They go to court entry, they get rapid rehousing, and then they're in the same exact unit as a rapid rehousing person. That is atypical. That is something that is built because of the cool things that the state of California is doing, and it makes the data a little weird.
Okay, we've got another question from Ruth Humphrey. So it says, so that I understand, FMR for ESG-CV is required if we have them in medium to long-term assistance housing. Is it required if we are using the funds for HP?
So I see two things in there. FMR for ESG-CV, it's actually waived for ESG-CV. So for ESG-CV funding, you only have to meet rent reasonableness with the units, which is a beautiful thing. And then the answer to the second question, is it required for homelessness prevention? The answer is yes. If you have ESG-CV funding and you are providing homelessness prevention, then those units must meet rent reasonableness, but not FMR, again, for ESG-CV specifically.
I'm going to take that one step further. We also have an expedited waiver at the state level that allows us to use rapid rehousing for annual ESG, but that is very specific. So reach out to your rep if you need to know which years. I believe it's 21 and 22. And that expedited waiver is set to expire at the end of this month. So there are some things we have to work on at the California HCD state level to make sure that that is something that we continue to do, because rent reasonableness is much more flexible than fair market rent.
And it looks like Ruth has her hand up too.
I have one more question. I got tired of typing. How, with the unorthodox way of individuals earning money, like DoorDash, you know, have they're working for themselves or whatever, what documents can we prove that they have income to enter them into either a rapid rehousing or a homeless prevention program, and what is acceptable? Because prior to this, we would use documents just to state, you know, they have zero income, and we would kind of try to verify that. But then I'm getting a lot of pushback when I'm asking for either bank statements or tax returns or something to prove that they make money outside of a normal regular 9 to 5. What documents or should we be asking for that to qualify them for our programs, either with rapid rehousing or ESG funds or our regular just ESG?
So, I mean, there's a couple of answers in there, I think. One of them is, you know, you want to try and get the best documentation that you can. And for that income that's not, you know, going to be on a standard pay stub or something like that, you probably are going to be looking at, you know, whatever kind of pay statement they get from any of the gig work that they're doing. You might be looking at like bank statements and things like that. If you get pushback on that, then, you know, you can always have other ways of having them certify their income. I think as you build relationships with them, it's prudent to try and, you know, again, do your best with documentation. But I think there is some flexibility that's probably warranted there, you know, because you want to do the best you can, but you also want to make sure that you're providing assistance to people who are eligible and need the assistance. You know what I mean?
Mike, I thank you for that answer. And I think it was Ruth that asked. Ruth, we are doing a session at the end of May, 5/31, on income documentation and verification that I think will be useful. Sorry, we're not doing it today. I know you want it today, but we haven't developed materials yet. But we will definitely be addressing this in a future session.
Okay, thank you. Because that's what I'm running into. I get individuals who, again, I understand you're working, but they get paid on a debit card or they get paid on a cash app, and there may not be technology savvy. So how would I get that information if, one, they don't know how to pull it up, or then they'll tell me that they're not working? In reality, they are, because they're doing, you know, even though it's not everyday work, you got income coming in. So how would I prove that?
Yeah.
Or how would I calculate that? You know what I'm saying?
And I think, Ruth, if you wouldn't mind, at the end of the session, we're going to have a survey that pops up. Do you mind putting some of those things that you're seeing as issues around income verification and around gig work or other things, so that we can assure that when we do that session, we 100% address those things? I would love that. Thank you.
Well, it looks like we've hit the top of the hour, and I don't see any other questions. So LaQuantia, why don't we turn it back over to you?
Thank you, Kristen. And thank you, Mike, for such an interesting topic today. And thank you everyone for your questions. As Chris just mentioned, when you exit out of this session, a survey will pop up. Please be sure to answer that for us so that we can provide you all with the feedback and things that you need to make our program successful. Have a good day and we'll see you next week.